The human reproductive system is one of the most intricate and precisely regulated systems in the entire body, and to truly understand whether pregnancy can occur during menstruation, we must first understand the complete journey of the menstrual cycle from beginning to end. The menstrual cycle is a monthly biological process that prepares the female body for the possibility of pregnancy, and it is controlled by a carefully balanced sequence of hormones produced by the brain and the ovaries working together in perfect coordination. This cycle typically lasts around 28 days, though it is completely normal for it to range anywhere between 21 and 35 days depending on the individual, and even the same person can experience variations from one month to the next due to factors like stress, diet, illness, sleep patterns, and overall hormonal health. The cycle begins on day 1, which is defined as the first day of menstrual bleeding, and during this phase, the uterus is actively shedding its inner lining, known as the endometrium, because no fertilized egg implanted during the previous cycle. This shedding process, which we call menstruation or a period, typically lasts between 3 and 7 days and is often accompanied by cramping, bloating, and hormonal shifts as the body resets and prepares to begin the cycle again. Most people are taught, or simply assume, that this phase of the cycle is completely safe from the risk of pregnancy, and while it is true that the probability is significantly lower during this time, the biological reality is more nuanced and more important to understand than that simple. Assumption suggests the key to understanding why pregnancy is still possible during a period lies in the extraordinary survival capability of sperm cells. Unlike the egg, which survives for only 12 to 24 hours after ovulation, sperm cells are remarkably resilient and can remain alive and fully functional inside the female reproductive tract for up to 5 full days after intercourse. This means that sperm introduced into the body on day 4 or 5 of a period can still be present, viable, and capable of fertilization several days later, long after the period has ended. So, if ovulation happens to occur earlier than expected, even on day 7 or 8 of the cycle, those surviving sperm cells are ready and waiting. Now, ovulation is the process by which a mature egg is released from one of the ovaries and begins its journey down the fallopian tube toward the uterus. In a textbook 28-day cycle, ovulation typically occurs around day 14, placing it safely far from the menstrual phase. However, in women with naturally shorter cycles of 21 to 24 days, ovulation can occur as early as day 7 or day 8, which is just a day or two after a typical period ends, and sometimes even while light spotting is still present. This biological overlap is the primary reason why the period is not a guaranteed safe window, and it is the scenario that most commonly leads to unintended pregnancy in women who believed they were protected by timing alone. Beyond cycle length, hormonal irregularity is another powerful factor that can shift ovulation unpredictably. Stress is one of the most common disruptors of the hormonal signals that control ovulation, and it can cause early or delayed ovulation in ways that are nearly impossible to detect without medical monitoring. Similarly, conditions like polycystic ovary syndrome, thyroid disorders, and rapid changes in body weight can all cause significant unpredictability in cycle timing. This means that even a woman who usually has a longer, regular cycle cannot be completely certain about the timing of ovulation in any given month without careful tracking or testing. Understanding all of this is not meant to cause fear, but rather to encourage informed awareness. Reproductive health knowledge is one of the most powerful tools available, and knowing how the body truly works, with all its complexity and variability, allows individuals to make better, safer, and more confident decisions about their health and their futures. Always consult a qualified healthcare provider for personalized guidance on reproductive health, contraception, and fertility planning.